Hello, my name is Sarah Woods, and I'm an assistant professor and director of behavioral health in the Department of Family and Community Medicine at UT Southwestern Medical Center in Dallas, Texas. Recently, two colleagues and I, Katie Bridges and Dr. Erica Carpenter, wrote a paper now published in Family Process titled The Critical Need to Recognize that Families Matter for Adult Health, a systematic review of the literature. The impetus for this project was what we consider to be a narrow lens in the relationships and adult health literature on the intimate partnership, especially marriage. Researchers emphasize that this relationship is likely the most meaningful and most central to adults, and therefore the relationship that we should especially understand in how it impacts adult health outcomes. However, there's not any empirical evidence to suggest that once we turn 18, our other family relationships somehow become less important. And given also that family relationships are likely to be longer and possibly more emotionally intense, as well as demographic changes in how American adults are partnering and marrying, if they marry at all, we decided that it would be worthwhile to complete a systematic review of the literature on families and health to better understand the representation of close family relationships other than the intimate partner in this research, as well as to understand the themes reflected in that literature. So to do that, we followed a four-step process that resulted in a collection of 9,684 research articles that in some way focused on families and health. We then removed articles that focused on things like the early childhood family environment or mental health dependent variables that were outside our scope, and that resulted in a collection of 72 research studies, or less than 1% of our initial pool. Our thematic coding of these 72 articles resulted in 6 themes. The first theme was family relationship quality. The second theme was family composition. The third theme was psychophysiological mediators. The fourth theme in the literature was behavioral factors in health and healthcare. The fifth theme was caregiving, and the sixth theme was aging health. Across these themes, we found things such as a focus on positive family relationships, especially measuring things like satisfaction and support, with less of a focus on family conflict. We also found evidence for the biobehavioral family model, which was strongly reflected in the literature, and is a theoretical orientation to explaining how our close family relationships affect our health across specific mechanisms of effect. We also found a great deal of focus in the health behavior literature, especially on diabetes self-care, as well as an additional emphasis on health-specific communication patterns within families. And we also found that family relationships may become especially potent in older age, for older adults, as caregiving needs grow and less important, more peripheral family relationships are trimmed. Overall, very few articles defined the construct of family. Occasionally, they purposefully left the term open-ended to allow participants to respond to measures of family quality or to invite family members to interventions in ways that they define who they consider to be family, which, while intuitive, limits our ability to understand who people are considering when they're describing their family members, and limits our ability to understand how these specific family members affect health. We also found that that was often how researchers ended up with other family members besides the intimate partnership in their research to begin with, as an unintentional after effect of not initially defining the construct of family. So we also found that across these themes in the literature, there was a focus on the developmental bookends of life. So especially for the effects of parenting young children with special health needs or adolescents on the adult parent's health, as well as the effects of caregiving and aging on older adults' health and their adult children's well-being. So this limited focus on the lifespan's bookends and family dyads where one person may have limited cognitive capacity, as well as a focus in the health behavior literature on specific disease management, really limits our understanding of how family relationships that occur in the large middle span of life affect adult health. So we're recommending that research start to include more frequently multi-dimensional measures of family relationships, capturing things like warmth and conflict, health behavior support and sabotage, as well as multiple family member reports, and also specifically inviting participants to define who they consider to be their family when they're participating in these projects. We also are recommending that family other than the marital partner be invited to participate in regular assessment and treatment in settings such as primary care, where we're working to intervene to improve adult health outcomes, and that could be especially aided through integrated family-oriented behavioral health care. Thank you so much for listening to our brief description of this project. We hope you are inspired to think about how close family relationships other than the intimate partnership dovetails with your own work with adult clients and research participants. And as you read this paper, we hope you will reach out to us with any questions you may have. Thank you.